I'm going to give a brief overview of kidneys and kidney cancer today. So we're going to go over the role of the kidney initially. We will talk about the magnitude of kidney cancer, how kidney cancer develops, and how we are going to diagnose it. We'll talk a little bit about types and stages of kidney cancer, and then very briefly about management of kidney cancer. So to start with, here is this picture shows you the role of the kidney in our body. If you see, I took this picture from Kidney Cancer Foundation. And as you see, the bean-shaped ones are our kidneys here. And the kidneys, the red column here is our aorta. And blood comes through the aorta to the kidney. And we can look at this picture clockwise if we start from one here. From the artery, blood flows into the kidney, and it goes through all these small units in the kidney that are called glomeruli. And glomeruli can tell waste from things that our body needs. So what the glomeruli does is basically it filters our blood. And the good part would go through the vein back to the body to go to the different organs that need it. And the waste material will go through the ureter into the bladder and will make urine. So the urine goes to the bladder, and then when the bladder is full, urine leaves the body. So the clean filtered blood through this process is back in the body. And our kidney does that every 30 minutes. So if a kidney is functioning well, every 30 minutes, this whole thing happens. So the major role of the kidney is to balance between the electrolytes, acid base, and the fluid in our body. It also has some other roles that I haven't shown in this picture, such as helping with the blood pressure, controlling the blood pressure, and helping with production of red blood cells in our body. This is how common kidney cancer is. This is based on American Cancer Society Cancer Fact and Figures of 2025. It gives us the estimates of kidney cancer incidence in 2025. And as you see, on the left is men and on the right is women. And kidney cancer is a little more common in men than women. It's probably 2 times more common than women. It is the 6th most common cancer in men. In women, kidney cancer is the 9th most common cancer. The picture below shows deaths, estimated deaths from kidney cancer in 2025. And as you see, neither in men nor in women, kidney cancer is not the most common cause of death in the top 10 most common cause of cancer deaths. So what is cancer? Before we start talking more about kidney cancer, what is cancer itself? Cancer is a group of diseases that basically is characterized by uncontrolled growth and spread of abnormal cells that take over normal cells in our body. So how does this happen? A lot of times cancer begins with gene changes that disrupt normal cell growth and division, allowing abnormal cells to survive and overtake the normal cells. And this happens based on several genes have been identified. For example, there are some genes, we call them tumor suppressor genes that normally suppress a tumor. But when these genes get mutated and they get turned off, then it results in cells undergoing uncontrolled growth. Or sometimes genes are normally turned off to prevent cancer, and then they get mutated, and then they get turned on, causing uncontrolled growth. Or sometimes our cells' DNA keep correcting their mistakes, but sometimes there is a mistake in the DNA that the cell cannot repair anymore, and that causes uncontrolled growth. So all these different abnormalities in the genes can cause the overgrowth of the cells. These changes come from for different reasons. For example, lifestyle factors can cause those mutations. Inherited genes can do that. You have all heard that some cancers can be through inheritance. Exposure to harmful substances or radiation. Oftentimes, though, it is just the cause is unknown. It's just we don't know why it happened. What are are the risk factors for kidney cancer? So for kidney cancer, smoking, vaping, excess body weight, and not having physical activity is the top cause for probably half of kidney cancers in the United States. There are other causes of kidney cancer also. For example, long-term uncontrolled blood pressure is a identified risk factor. Chronic kidney failure, when our kidneys chronically are not working well. Chemical exposure to different substances, such as the most common one is TCE. As we age, our risk of having kidney cancer goes up. And some of the kidney cancer rarely can be hereditary, coming from inherited genes. The most known one is a hereditary syndrome called von Hippel-Lindau disease, that it comes from inherited VHL gene mutation that can cause kidney cancer. How do we diagnose kidney cancer? So I know that we are going to hear more about methods of diagnosis of kidney cancer, so we'll stay brief here. Most commonly, kidney cancers are found just by chance. You're doing imaging tests for some other medical problem, or for example, you have been in a car accident and you go to the ED and they want to check your body to make sure for the trauma, and they do scans and they find, we call it incidentally, they find that there is a tumor on one of your kidneys. So that's the most common way we find it these days. But it could be also that you could have other ways to finding it. For example, you might have symptoms from it, like flank pain or blood in your urine. So medical history and exam can help. Blood tests can help us to look for the blood in the urine, look for the kidney function. Imaging, CT scans, CAT scans, or MRIs with contrast. And sometimes we use some other types of imaging also for the diagnosis. Sometimes we use a needle biopsy. So I know we're going to talk again more about it, but I just wanted to bring this up, that for most cancers, we should do a biopsy to confirm cancer before starting any kind of treatment. Kidney cancer is a little different. When we have a tumor that is contained in the kidney, most times without doing a biopsy, we remove that tumor. And we look, after removing the tumor, we look at it under the microscope. So we don't biopsy it. And this would be both what we call diagnostic and therapeutic, meaning that removing the tumor both gives us a diagnosis and we are already treating the tumor with it. And I put there genetic testing because, as we said, there is sometimes some rare inherited kidney cancers that we want to do genetic testing to confirm them. There are different types of kidney cancers. So the most common type of kidney cancer is what's called renal cell carcinoma, or RCC, which is when cancer starts in the tissue of the kidney, where the cells that line the renal tubules that we just talked about them. So 9 out of 10 of kidney cancers are renal cell carcinomas. There are other types of kidney cancers that are not very common, but I put them down here for your review. We can have urothelial carcinoma that starts in the cells that line the renal pelvis and ureter that drain the kidney. We can have sometimes Wilms tumor or nephroblastoma that usually seen in young children. We can have renal sarcoma. Sarcoma is when it starts in the blood vessels and connective tissue of the kidney. Again, these are not common. Maybe 1 out of 10 of all kidney cancers can be any of these. Now, renal cell carcinoma, this most common type, also has different subtypes. The most common subtype of renal cell carcinoma is what's called clear cell carcinoma. This is the picture of how clear cell carcinoma cells look under the microscope. And as you see, these cells look like transparent clear cells, and that's why it's named. It is pretty most common. It's 7 out of 10 people with renal cell carcinoma are diagnosed with clear cell subtype. And then there are other subtypes that we bulk them together and we call them non-clear cell carcinomas. The non-clear cells, most common is papillary carcinoma. Papillary non-clear cell carcinoma is 1 out of 10 of patients with RCC. And then we have chromophobe This is another type of non-clear cell RCC, may be seen in less than 1 out of 10 patients. And as you see, the cells are again clear but larger. And then there are the rarer types of non-clear cell RCC. I didn't put them all down. There are several of them, such as collecting duct carcinoma, renal medullary carcinoma, translocation RCC. We even have a subtype that we call it unclassified, not otherwise specified RCC. Now, all of these different subtypes can have features that we call sarcomatoid. This is a picture of a sarcomatoid feature in a patient with clear cell RCC. Sarcomatoid features are seen in less than 1 out of 10 and in RCC tumors. And what that means is those RCC cells look like cells of sarcomas, looks like cells of cancer of connective tissue, such as our soft tissue, muscle, fat, blood vessels. And these, when these features are seen, unfortunately, it tells us that this is a more aggressive cancer, meaning that it spreads more quickly and it tends to go out of the kidney and it becomes harder to treat. As you see here, the cells also look more aggressive. The clear cell on the left, it's round-shaped cells, and here the cells look more angry and aggressive looking. Now, how do we do staging? You've probably heard about different staging in cancer, and the most common type of staging that we use is what we call TNM scores in different tumors. T stands for tumors, which is depth and size of the primary tumor. N stands for node, lymph node, if cancer has spread to nearby lymph nodes. M stands for metastasis, if cancer has spread to distant parts of the body. So based on these, then we give scores to each of these and we stage the cancer. And the next couple of slides will walk through this. This is a picture of the kidney. So this is our kidney. There is the adrenal gland, this triangular shaped cream tissue you see above the kidney is the adrenal gland. The kidney and adrenal gland, they are covered in a fatty layer. And then all of that is covered in a fibrous tissue called Gerota's fascia. So this is how the kidney structure anatomy is. I put a picture of a baseball there because a baseball is about 7 centimeters. And that is basically the measurement that we use for how big the kidney tumor is. So this is how the measurement goes. On the left, you see T1, stage 1, and this is when the kidney tumor is inside the kidney and it's less than 7 centimeters, so less than the size of a baseball. And then when the kidney tumor grows, if it grows 7 centimeters or above that, that's called the stage 2, as long as it's still confined to the kidney itself. Tumor stage 3 is when the tumor spreads to the nearby veins or fat in the tissue. So you see that the tumor is now going through the vein of the kidney, outside of the kidney. And the last one on the right is tumor stage 4 is when that the tumor grows even beyond the Gerota's fascia, the fascia that covers the whole kidney. So that's tumor stage 4, or if it goes to the adrenal gland, it's called tumor stage 4. For lymph nodes, it's pretty simple. N0 is when there is no regional lymph nodes involved, and N1 is when there is spread to regional lymph nodes. M metastasis is again simple. M0 is when there is no distant metastasis spread to the other organs, and M1 is when there is distant spread to other organs. So to put all these together, stage 1 is when the cancer is T1, N0, M0, meaning a small tumor less than 7 centimeters found only inside the kidney. Stage 2 is tumor 2, N0, M0. So a bigger tumor, bigger than 7 centimeters, but still only confined to the kidney. Stage 3 is T3 or N1. But should be M0, meaning that the tumor has spread to nearby veins or fats, or could have spread to the lymph nodes. And stage 4 is either a T4 disease or an M1 disease. So cancer has grown beyond Gerota's fascia or into the adrenal gland, or has even spread to distant organs. All right, so we'll move on to how to treat kidney cancer. So treatment of RCC is based on different things, and it gets individualized for each patient. So it depends on type and subtype of the kidney cancer that we just talked about. It depends on tumor size, location, if the cancer has spread to other organs in the body or metastasized, and then I've put their performance status. This is very important when we decide what treatment we can give for the cancer. Performance status is what a person's general level of fitness and ability to perform their daily tasks. And that helps us to select the best treatment that is the best fit for them. For treating kidney cancer, there's a multidisciplinary care team involved. I've put a number of the specialties that work in managing kidney cancer. Medical oncologist that gives you the treatments, urologist does your surgeries, radiation oncologist might in some cases can give radiation therapy. We have the pathologist that helps us with the diagnosis, nephrologist that helps us with managing the kidney function while we are treating. Interventional radiologists, sorry, I skipped that. They help us with biopsy or other, sometimes some localized treatment options. We have palliative care team that can help us with management of the symptoms. And if we are on a clinical study, the research team is there to help us too. I also wanted to note other people that work in the background with us, and they might not be acknowledged sometimes. Our pharmacists help us with, again, treatment and side effect management. We have the dietitians, genetic counselors in some cases. Social workers are there to help us, psychologists or psychiatrists, nurses, advanced practice providers, such as our physician assistants, nurse practitioners. And last but not least, our primary care doctor has a very important role in helping us manage our cancer. So it doesn't mean that when you have cancer, you don't need to see your primary care doctor anymore. We work very closely with your primary care doctors to help us manage your symptoms. So again, I'll briefly go over the treatments of kidney cancer. Sometimes in small tumors, we just watch it. We call that active surveillance, meaning that we do imaging tests on a regular basis. And that's usually done for smaller tumors, T1 tumors, or that are less than 2 centimeters. We sometimes do surgery. And surgery is to remove the tumor. Surgery can be partial or radical nephrectomy. Here are two pictures of what this means. The top picture is showing partial nephrectomy. And partial nephrectomy is when we remove the tumor and the tissue immediately surrounding the tumor. What we leave behind still a functioning kidney. Radical nephrectomy is done when partial is not possible. So the whole kidney is removed, and sometimes may remove adrenal gland and the nearby lymph nodes. So this is the picture below that you see the whole kidney is removed. These surgeries can be done open or by what we call robotic surgeries or minimally invasive surgeries. Also, there are other types of local treatment of kidney cancer. Again, what we call ablation is usually done in smaller tumors of 3 centimeters or less. There are different ways of ablation, cryoablation or cryosurgery, which is killing cancer by freezing them. A radio frequency ablation or RFA is killing cancer by heating them. And microwave ablation is killing cancer cells using electromagnetic energy. And as we mentioned before, we sometimes use radiation therapy. Stereotactic body radiation therapy, or SBRT, is sometimes used for killing smaller tumors. And sometimes in the course of our cancer, we might also use external beam radiation therapy. And now we get into the systemic therapy. That's what I do as a medical oncologist. So systemic therapy is a treatment that you take through your vein or pills, and it goes through your whole bloodstream and kills the cancer. So there are two different groups of treatments for kidney cancer that we use. One is immunotherapy. And immunotherapies are drugs that are given through your vein. And basically what they do is they take the brakes off of your immune system to fight the cancer, because cancer is sneaky and it puts some stop signs to fool our immune system. So immune system would leave it alone. But these drugs basically take those stop signs away and our immune system gets activated and kills our cancer. The other big group of drugs that we use in treating kidney cancer is targeted therapy. Targeted therapy drugs also are drugs that, again, they're like they have a GPS and then they go exactly where they should kill the cancer, and then they do it there rather than just going everywhere. So they basically target those bad switches that are causing the cancer. I struck chemotherapy off here because we really don't use chemotherapy in treating kidney cancer. So the classic chemotherapy that you have heard of, we don't use it in our renal cell carcinomas. I put down their clinical trials and I'll briefly talk about them. These are medical research studies investigating new ways of treating cancer, and we always advocate for exploring clinical trials if we want to pick treatment. And then there are general supportive care that we use in treatment of kidney cancer. This includes pain relief, palliative care for symptom management, emotional support, financial aid some patients might need, family counseling, diet counseling, you name it. So again, the big multidisciplinary team. I have one slide on key points on clinical trials. I know we have a whole session about that. So what is a clinical trial? It's a medical research study testing new drugs, devices, treatments after they have already been developed in the lab. Because before these get approved, we should confirm that they're safe and effective. Clinical trial comes in different phases. Phase 1 is when we look at the dose of the treatment, safety and side effects, and sometimes we see early signs of benefit. Phase 2, we look at effectiveness against a specific cancer. In phase 3s, we look at large group of patients to compare this new agent to standard treatment, and these may lead to FDA approvals. And phase 4 is when we follow that agent for long-term safety and benefit of the approved treatment. So again, we're going to discuss these further in the next sessions. So this was really a brief overview, quick overview, just touching on the points. I want to acknowledge all the patients and their caregivers that help us manage cancer of the kidneys. And I want to thank all of you. That's my dog on one of our campings in the Bitsy Badlands. That's north of New Mexico. So I want you to visit our state. New Mexico is not as well known. It's a beautiful state with different types of landscapes, and I'm sure you'll enjoy visiting us here. Thank you for having me.